Hello, everybody. Welcome to a special episode of Heartache, Health, and Healing. This episode is going to be unlike any other that I have done. Late last year, I was invited to participate in a Podcasthon where I got to pick a charity of choice. And in July of 2024, we unfortunately had found out that my brother-in-law has stage 4 pancreatic cancer. So knowing that, I immediately knew that I wanted to participate in the Podcasthon, and I knew immediately what my charity of choice was going to be, which is the Pancreatic Cancer Action Network, also known as PanCAN. So in this episode, I interviewed two individuals that are part of the organization and have been directly affected by this horrible disease. So please listen in on this episode and listen to what they all have to share about the organization and their personal experiences. And in the show notes, I will be leaving the links for the organization itself, along with the link to my sister's team. So that the Pancreatic Cancer Action Network holds an event called Purple Strides every year. So my sister has a team formed for her husband called Gary's Gorillas. And so if you are being called to donate either to her team or to the organization itself, I will leave both links into the show notes. And so we would love it if you could donate to help support this organization and everything that they're doing. So listen in on this great episode, and please share it with everybody, get it out to the world, because we need to bring awareness and raise funds for this tragic disease. So thank you so much for listening, and I hope you enjoy the episode. Hello, everybody. Welcome back to the podcast. Today's episode is dedicated to raising awareness about pancreatic cancer and the incredible work of the Pancreatic Cancer Action Network, or PanCAN. PanCAN is a national organization focused on fighting pancreatic cancer through research, patient services, community outreach, and advocacy. Their mission is to improve outcomes for those affected by this devastating disease. I'm joined by two amazing guests who bring both personal and professional perspectives to this conversation. First, we have Katie, a dedicated PanCAN volunteer who tragically lost her mom to pancreatic cancer last year. Katie works in the research field, and her passion for advancing pancreatic cancer treatment and support is truly inspiring. Our second guest is Linda, a courageous pancreatic cancer survivor who received life-changing treatment through a PanCAN recommended clinical trial. And Linda's story is sure to be powerful, true powerful testament of the impact of the research, partnership, and hope. And together we'll discuss their personal journeys, the importance of PanCAN's work, and how we can all get involved to make a difference in fighting against pancreatic cancer. Katie and Linda, thank you so very much for taking time out of your day to be here with me to get the word out there about pancreatic cancer, about the PanCAN organization, and what they all do to help people. So I would like to start out the conversation. Katie, if I could start with you, if you could share a little bit about your personal journey with pancreatic cancer and then how you became to get involved in the organization.
Sure. Yeah, so in 2018, my mom was diagnosed with stage 4 pancreatic cancer, and she received the standard of care regimen. The FOLFIRINOX was her first line, and she did really well. She did 6 months of treatment. We Throughout that time, got second opinions. She was treated locally at UW Carbone Cancer Center in our Johnson Creek location. And we also did go in downtown to the University Hospital to get second opinions. At that time, they both, the surgeons and medical oncologists felt that her tumor was still inoperable. It was wrapped around an artery. And so the best course was to continue chemotherapy. And at that time, I knew I wanted to do something. I knew I wanted to get involved. I wanted to do something. And I had Googled, pancreatic cancer walks and trying to see, what was available for caregivers, especially I was wait, now I have to think about it. I think I was 29 when my mom was diagnosed, and I'm an only child. And so my mom and I were always very close, and I wanted to do something to raise awareness. One of the medical oncologists also pointed us towards PanCAN, and so that was kind of how I got involved. One of the oncologists said you should check out PanCAN for more information, kind of see what they have to offer as far as like dietary, options and things like that. So we were very fortunate to find PanCAN early on in her diagnosis. I know it kind of ends up being a hidden search. So we felt very lucky that we were able to get involved.
Awesome. Thank you for sharing that. Linda, I would love it if you could share part of your journey, as much as you're willing to share, being a pancreatic cancer survivor and then what it was like receiving that diagnosis.
Okay, I was diagnosed in October of 2020. I had some elective surgery and they discovered a cyst on my pancreas. I had no symptoms. I had no idea there was anything going on with the pancreas. They did a biopsy of the cyst and it turned out negative. So they said, we're going to go in and do some surgery and remove this cyst. So they removed the cyst. And then, of course, it did turn out to be pancreatic cancer, which was quite a shock to me because I went into the surgery thinking everything was fine. Receiving the diagnosis was, of course, difficult. I was at stage 2 at that time, but right after I was diagnosed, Alex Trebek died the very next day. So that was kind of an eye-opening experience. When I was diagnosed, then I was referred to oncology at Aurora Healthcare in Milwaukee. And the first day that I met with the oncologist, he put me in contact with PanCAN. So when I got home from my oncology appointment, I had a very nice welcome letter from PanCAN saying, we're here for you. What can we do for you? You're already enrolled in the Know Your Tumor program, which they did analysis of my tumor, and I was able to find out the genetic mutations. And with help from family, I'm blessed with a family of oncology pharmacist and oncology RN. So I had some close family that I could rely on to get some help, some advice, and knowing that things were going okay. So after about a year of receiving standard of care through Aurora Healthcare, my cancer spread to stage 4, which I'm currently at stage 4. And I knew at that time I needed to do something a little bit more aggressive than standard of care. So that's when because my insurance had changed, I was able to switch my my oncology services to Freighter Healthcare, which is a partner, I guess, with PanCAN.
Okay.
And I knew that I needed to do something more than just standard of care. So I used PanCAN for their Find a Clinical Trial program. I sent them all my medical records, and a very nice nurse navigator went through them and directed me to a couple different locations. Unfortunately, I tried all those locations and I was rejected by all of them. So I went back to PanCAN and said, is there anything else, any other clinical trials that I can try? And they said, well, we're not sure of any, but we're going to refer you to an organization called Cancer Care. And they paid for that. And this Cancer Care organization put me in contact with a clinical trial that I was eventually enrolled in. Unfortunately, it was a T-cell therapy. And unfortunately, that did not work. But being enrolled in Freighter, my oncologist, who's wonderful there, said, well, that clinical trial didn't work, but we know of another one that will work. And that did work. It made me cancer-free or no evidence of disease for about 6 months.
Awesome.
And now I'm back on chemotherapy, and it appears to be working right now. So that's sort of my journey in a nutshell.
Oh, that's good. I'm glad to hear that it's working, and hopefully it'll continue working.
Yep.
Absolutely awesome. So I guess Katie, I'm going to direct this towards you. So, PanCAN emphasizes the importance of research and clinical trials. Can you explain how the organization supports the advancements in treatment?
Yeah, so PanCAN, like Linda mentioned, has a couple of different things for patients. One of them is the Know Your Tumor program. And what's really nice about the Know Your Tumor program is when a patient or oncologist reaches out, like Linda spoke about, they will send the tumor tissue off for genetic testing. And they do the sequencing of the tumor. A lot of pancreatic cancer cells end up having a similar tumor makeup, but knowing that specific, those specific markers can tailor treatments similar to what Linda spoke about too. There's a lot of clinical trials out there that are trying to target some of those KRAS G12C, KRAS G12D trials, to try to get the target those specific mutations in the tumor. And they also did launch their own clinical trial. It was called Precision Promise. I believe that it is now closed to enrollment and they are no longer accepting new patients, but that was a trial that was open, I believe, at Heartache too in Milwaukee. So PanCAN has partnered with many institutions to open that clinical trial as well.
Okay. So, Linda, what was your experience like going through? I know you did share a little bit about that already, but would you be able to share a little bit more about going through the clinical trial and then like the moments of hope and strength that kept you going through all that?
Well, again, I've been in 2 clinical trials. Already looking at a third one to get on a waiting list for. I'm G12V, so I have to go through MD Anderson. But the first clinical trial that I was in at the National Institutes of Health in Bethesda, Washington. That was amazing. There was an amazing team of doctors there. Everybody took such good care of me. I was very, very hopeful, but yet realistic because T-cell therapy works very rarely on pancreatic cancer. But they took such good care of me. And then the second clinical trial that I was on, my oncologist, I remember vividly when he came into the room and he's like, "Oh my gosh, you have the MTAP deletion in your tumor." And, they found that from the Know Your Tumor program through PanCAN. And he's like, "I can't believe I haven't thought of this clinical trial already, but we've had some really good success with it." And again, it kept me no evidence of disease for 6 months. And as they enrolled me in that program, it was seamless through Heartache. And it was, and Heartache is in my back door, literally a mile away. So being enrolled in that clinical trial was so easy and so effective and just amazing.
Awesome. So Katie, from a family's perspective, so you kind of being on the other side of it, so where you lost you lost your mom to pancreatic cancer. So how does PanCAN help somebody like in your shoes from the supporting for that caretaker?
Yeah, so PanCAN also has different groups, and they do have a caregiver kind of support network. I did enroll, and then I kind of ended up, doing my own thing, meeting lots of people like Linda. Getting involved really has been the best thing because I've met people like Linda, like some of our other volunteers who have either lost someone or they're survivors themselves. And so it kind of builds the community together, volunteering. Events like Purple Stride every year bring together so many people. And I've met, lots of different people through volunteering the last 4 or 5 years at Purple Stride. So that is a nice support to get to know others that have been, in the same situation.
Yeah. Because pancreatic cancer is often diagnosed late, making it difficult for treatment. So why do you feel, and either one of you can answer this or both of you can answer this. So why is the awareness so critical in fighting this disease?
Well, again, a lot of times there's no symptoms. Like in my case, I had no symptoms of the disease at all. It was found by accident. And a lot of people aren't as lucky as me to have it found by accident at stage 2, there's no symptoms and they're not diagnosed until stage 4. And sometimes the tumor is so enwrapped and around the pink that surgery isn't an option and chemotherapy doesn't work as well. So I think it's because of that, we need to find other ways to try and diagnose this earlier when somebody doesn't have symptoms, like maybe based on some genetic things or, you know, other medical reasons why they might be at risk for pancreatic cancer. And that's something that we have to get the word out on. What are the risk factors and are you genetically prone to it?
So how does somebody go find that out? What are like some steps that they could take? So, I mean, to kind of know the risk factors and if they're prone to it.
Yeah, PanCAN shares a lot of our risk factors.
Okay.
So, and knowing the symptoms, like Linda said, you know, a lot of times people don't know what the symptoms are. For example, my mom, her final symptom was just really severe back pain that just would not go away. And it was mid back pain. And a lot of people with pancreatic cancer are treated for a lot of other GI things. You know, they will say maybe, oh, you have GERD or you have some sort of other, you know, intestinal thing. And so I think just really pushing patients to advocate on your behalf and say, no, something is wrong. Is great. But yes, we, you know, on our website too, it'll show yellowing of the skin, which again is usually more, you know, stage 4.
Okay.
Yellowing of the skin, bloating, you know, irritability with stomach, mid back pain, things like that. But as far as risk factors, I was also someone who pushed really hard for our family. I had my mom before she passed get tested for, there are certain genetic markers. A lot of times they're known as the breast cancer genes, but they are the BRCA, the BRCA genes that, and a few other genes that they can test for a panel. My mom was actually negative. None of her markers were impacted. And so then I didn't need further testing, but it is, you know, if someone is diagnosed, it is nice if they can get tested to know, you know, to reach other first line relatives as well.
So what do you think are some of the biggest misconceptions about pancreatic cancer? Either one of you can answer that.
I mean, one misconception is people think that they're going to die the very next day. And that's not true. Sometimes when it's identified early, there are treatments and there's more and more treatments coming out. There's a lot of targeted therapies for these specific gene mutations that really are showing some promise. So I think, I mean, just to elaborate on your question, for somebody to get in contact with a very knowledgeable oncologist who specializes in pancreatic cancer is key to survival. And patients can survive. Our survival rate is improving. You know, patients can live 4, 5, 6 years with pancreatic cancer. It's not a you die the next day type of diagnosis anymore.
Well, that's
Yes,
actually
I echo that.
good to hear. That's good to hear because I don't want to, the reason why, and I may have shared this with you guys, but the reason why I had chose PanCAN organization as the charity of choice for this podcast was because my brother-in-law was diagnosed about summer with stage 4 pancreatic cancer. And it's like our hearts just dropped to the pit of our stomach because anybody that I've known that has had it has not survived it. And I probably I'm one of those that have that misconception of like, their days are numbered. I mean that their survival rate is like so low, and so it's good to hear that the survival rate has been getting better, and so that's very good to hear that.
Right, I've been stage 4 for 3 years now.
Oh, really? Okay.
Yeah. So my mom lived 5.5 years, stage 4 unresectable cancer. So unfortunately, my mom had 2 primary cancers. So my mom was found ineligible for any of we did the Know Your Tumor. We did get connected. PanCAN has the largest pancreatic cancer resources for clinical trials anywhere. And so they did connect us. She was screened, but because she had, you know, a different primary cancer years before that, she was ineligible to do any trials really. So yes, she did both kinds of standard of care therapy on and off for 5.5 years. And like Linda said, I think it's really important to tell people it's not a death sentence. There's a lot of hope out there. There's a lot of research being done. However, I think we still can get better. I still think that there's room for improvement in the early detection. Like Linda said, trying to catch it, you know, through early blood tests or early other screenings that we can do, because it is so hard to find and lacks symptoms.
Now, is that something that is more, as far as like the early detection, is that more something like on a person's practitioner, you know, like their doctor that they go see, or is that something that PanCAN kind of helps guide people with for that early detection?
I think the early detection, we should be educating some other physicians a little bit more. I've talked to a lot of other survivors, and many have gone, as Katie had said before, the GI route, where they think that maybe there's colitis or there's some other type of GI thing, and they don't necessarily refer somebody for a CAT scan or MRI, which is going to really show a tumor. So primary care physicians and GI physicians could be educated probably a little bit more, and what are some of the signs of pancreatic cancer, and to investigate that as opposed to just brushing it off as some stomach issue or something like that.
I just out of curiosity, I don't know if you guys know the answer to this or not, but are there any physicians that are part of the PanCAN organization? I mean, like just general practitioners, or like more GI related. I mean, like you were saying, to educate them more. Do you know if there's any of those type of people involved in the network at all or not?
I think charity wide, yes, we have a chief of staff who is, you know, is a physician, I believe. At the local level, there are certain medical oncologists, like Linda said, who partner with PanCAN and know, you know, to refer a patient to PanCAN to help kind of facilitate and guide the testing for the Know Your Tumor and clinical trials.
So what do you feel are some of can you share kind of from a overall perspective, like what are some of the big things that PanCAN does for the people that are dealing with pancreatic cancer, as well as the families that have someone that's suffering from pancreatic cancer?
I would say a lot of our big things are, you know, some of our events. In the fall, especially November is Pancreatic Cancer Awareness Month. So there's always several events around that. We had a Purple Light ceremony, actually sponsored by Linda and her husband in Milwaukee this year, where families come to remember and honor survivors and those that have passed. And then every spring, we also have Purple Stride, which brings everybody together for the big walk. On the website, PanCAN's got a lot of great resources from dietitians. You know, we have a Facebook page where things are posted with the updated, you know, anytime there's a new FDA approval, PanCAN's the first one to kind of push out emails if you're on their email list. They try to keep people very much aware of the updated things.
So how about you, Linda, from your perspective? What did you feel are the most beneficial things in that where they've helped you out and assisted you?
Well, the website was just a world of information when I was first diagnosed. And the fact that on my day of diagnosis, they reached out to me was just so heartwarming. It gave me, you know, quite a bit of hope. And again, I just can't reiterate how wonderful the nurse navigator was with me. And, you know, she never gave up on trying to find me in my first clinical trial. the support has been wonderful. And as Katie had mentioned before, our Wisconsin affiliate has just some wonderful people that have been so supportive to me. Looking at me as a survivor and really asking me about my treatment and really caring. I've never met a group of such caring individuals.
That's awesome. So, Linda, with you being someone that was, diagnosed with pancreatic cancer, so somebody that received the diagnosis, I mean, I'm sure that can be very overwhelming and very scary. What would you say to somebody that's going through this beginning stages?
It's okay to take a day or two to cry and have your pity party and feel sorry for yourself. And then, as the saying goes, put your big shoes on and move forward. And as far as what I found very helpful for me is I was very open. I shared my news with everybody that I knew. I set up a Caring Bridge site, and I just, got a huge network of people that were caring for me and rooting for me, and sometimes you get advice like, well, if you try this one herbal medicine, it will help my mom, it'll help you, and you just smile and say, thank you for the advice. But you will run into people. Again, I said, I have a sister-in-law who's an oncology pharmacist and a daughter who is an oncology RN. I was very blessed to have a network like that. So you never ever know where you're going to have a connection. And just to be open and honest and take advantage of those connections. I call my daughter all the time and I'm like, what does this mean? What does this mean? And, I don't even care that I bother her during her dinner or her time with her daughter. It's about me. And it's okay that you say it's about you.
Yeah. So looking ahead, so what gives you hope for the future in the fight against pancreatic cancer? And you can each take a turn answering that if you want.
Well, as I had said before, and just to reiterate, there's so much research that is being done now, and they're looking at targeting a lot of these gene mutations, and that's where some of the future is. There's always new treatments that are coming out. My oncologist always comes in with plan A, plan B, plan C. So there is definitely a lot of hope out there.
Good.
Yes,
That's good to hear.
Yeah, and I echo that. I do work in research, and I've noticed since my mom's diagnosis in 2018, a lot of our the physicians and things do actually look at clinical trials as a first line therapy now, because it shouldn't be looked at as the last option. It's not a last resort. These are all, like Linda said, very unique and targeted therapies, and it's great that we're tailoring the treatment to the specific patient. And I think that's one thing that's really great about PanCAN's Know Your Tumor is that they really can find the specific mutation makeup and then look for the targeted therapy. Although, like Linda said, the patient may have to travel quite a ways, but it is a unique setup.
Yeah. So how can listeners support PanCAN or get involved in the fight against pancreatic cancer? What are some of the best ways?
I think, raising awareness, wearing purple in November, definitely checking out our website, pancan.org. We also have the Purple Stride website is set up. That's our big walk every year. So it's purplestride.org/Wisconsin, and it'll be in Waukesha again this year. But yeah, looking it up, letting your friends and family know that it's an option to walk and hang out.
So for people that want to donate, so the Purple Strides, that happens like all over the place. So if we have listeners like outside of Wisconsin, does that happen all over the place for all the different chapters?
Yes, Purple Stride now is one big day, and it is on April 26th, I believe. I should know it off the top of my head, sorry. Yes, April 26th, 2025. But it happens all over the nation, so we turn the nation. And you can kind of look for your local affiliate. There's generally one in every state. Not all states have one, but if you go to pancan.org, there will be a link directly to Purple Stride, and then you can see where the events are. But there also is an option to do Purple Stride USA, where you kind of do your own thing. Like that happened during the year of the pandemic. We did not hold, obviously the big Purple Stride events. So we had Purple Stride USA was kind of created that year where people could walk in their neighborhood, raise awareness. You can link your Facebook page to your fundraiser and things like that to share with your family and friends.
Awesome. So, because they're able to donate either through Purple Strides or directly on the PanCAN website, right?
Correct. Yes.
Okay. That's what I thought. So to wrap up this conversation, I would like to ask each of you to answer this question. So if you could leave all of the listeners with one message of hope or action, what would that be? Whoever wants to go first.
I would say never give up hope. Always be your own advocate. If you know someone who has pancreatic cancer, be kind, encourage them. If you have pancreatic cancer, again, you have to be your own advocate. You have to search out and use the resources that are there to guide you in your treatment. Don't assume that your oncologist is going to do everything for you. Ask questions, make sure, follow up. The Freighter team knows me very well. I had some test results just come out this morning, and I was already messaging them. What does this mean? What are we going to do next? What's going to happen? So never think that you're bothering people. You are never a bother. It's your journey, your experience. Do what you can for you. You come first.
Awesome. How about you, Katie?
Yes, I echo exactly what Linda said. Actually, my mom's oncologist was the one who reminded my mom that the squeaky wheel gets the grease. So she was one to not want to complain as well. She didn't want to bother anyone. But yes, you do need to be your own advocate. I think it's really good to research on your own, but also then take the advice of, the oncology team who has seen and worked in their field. But definitely, advocate for yourself, advocate for your friends and family, and know the symptoms, know the signs so that you can, help direct somebody.
Awesome. So do either of you have any final words that you would like to share about the organization?
I think, I feel very blessed to have found the organization when we did, like Linda said. And I do think that there's a lot of great people in our area. There's a lot of people all over the United States in these affiliates. So if you can, even if you aren't someone who wants to volunteer full time or get involved, showing up to some of these, they have little coffee events or they have these Purple Light events or the Purple Stride, but meeting people and getting involved and building a community is really important too. It helps everyone feel good. It really, really is heartwarming to see all the survivors. Even as somebody who lost someone dear to them, I love when I can see all the people on the stage that are surviving. So get out there and get involved. And there's a ton of great people in the organization. So
awesome.
And I would echo what Katie was saying. What has made me feel so good is I feel so welcome, and everybody is just, it's so heartwarming, and everybody asks me to share my story, and it's just amazing.
Awesome. Well, I thank you both for taking time out of your day today and spending it with me to bring awareness to pancreatic cancer and the Pancreatic Cancer Action Network. So I greatly appreciate that. And I know my sister, she's forming a team of Purple Strides in her area. She's down in Waukesha. So I will be participating in that when she gets that all together, when she forms her team in, you said it was April, right?
Yes.
Yeah,
yes.
okay.
April 26th. Yep. Yes. Yeah. Well, we look forward to seeing you there.
Yes. Everybody, please go out and support this support Pancreatic Cancer Action Network, support PanCAN, and it's sad that I feel it's sad that it takes something when it finally hits close to home that you finally feel like that you do something about it. And just because there's just like so much nasty stuff out there, but I'm glad that the organization is here and how helpful it has been for both of you. And I look forward to seeing how helpful it is for my sister and her family as well. So again, Katie, Linda, thank you so very much for taking time out of your day. I hope you have a fabulous, we're recording this at between the holidays. So hope you both have a great New Year's, and wishing you both the best in the upcoming year. And yeah, hope I'll see you in April at the Purple Strides.
Thank you. Thank you so much.
Yeah.
Everybody.
Yeah, thank you.
Thanks. Everybody, please go out and support the cause. It's so very important. Pancreatic cancer is just one of those nasty ones. All cancer is nasty, but just because of the late detection makes it more challenging. So we'd love for you to go out and support. I will put all the links to the association in the show notes, so you have easy access to donate if your heart feels pulled to do that. And everybody, thank you so much for listening, and have a fabulous day.